Today we're going to talk about the role of nutrition in mood disorders. And the first thing I'd like to talk about is these chemical messengers in the brain that we call neurotransmitters. What we need to talk about and understand is how these neurotransmitters are created, and most of the neurotransmitters in the brain are actually derived from amino acids. Amino acids are building blocks for protein, and also the substrate or building blocks for many of the neurotransmitters that control our emotions. For example, tryptophan is an amino acid that is converted to the neurotransmitter serotonin. Now, there are a lot of medications out there on the market that are designed to increase serotonin levels in the brain, but in a more natural way, you can take one of these amino acids like tryptophan and increase your serotonin levels. As another example, tyrosine is an amino acid and it's converted to the neurotransmitter dopamine. Tyrosine is also converted to epinephrine and norepinephrine. So by looking at neurotransmitters and measuring neurotransmitters, you can oftentimes find imbalances that can be easily treated in a more natural way. It gets a little more complicated in that certain cofactors are required for the conversion of some of these amino acids into the neurotransmitter. For example, iron is an important cofactor for the transformation of the neurotransmitter tyrosine to dopamine. So on the one hand, you may not have enough tyrosine to create dopamine, or you may not have enough iron to convert tyrosine to dopamine. And this is a very common problem that we see, at least a situation where someone has a low iron level and they can't convert tyrosine to dopamine, and in effect end up with what we refer to as a dopamine deficiency syndrome. The symptoms include such things as apathy, not being able to experience pleasure, depression, fatigue, and so on. And we see low iron levels for a variety of reasons. You can see it in a situation where someone's having, female for example, having heavy menstrual flow and iron loss that way. More frequently, we're seeing patients with low iron levels that are on acid blocking medications like Prilosec for their heartburn. And as it turns out, when you block all of the acid in the stomach, there are some unintended consequences, and that can lead to a decrease in a variety of vitamins and minerals. So you're on Prilosec for your heartburn, you block all the acid in the stomach, you can't absorb iron, now you can't convert tyrosine to dopamine, and you end up with a dopamine deficiency syndrome. As another example, vitamin B6 is necessary for the conversion of the amino acid tryptophan to serotonin. And if you don't have enough vitamin B6, then you can end up with a serotonin deficiency syndrome. So I think you can begin to see how there is a real relationship between nutritional deficiencies and mood disorders. Just to throw out a few other examples, study was done last year looking at active duty military personnel. They measured omega-3 fatty acid levels, basically measured their fish oil levels in the blood, and they found that in those soldiers whose omega-3 fatty acid levels were low, they had a 60% higher increase of suicide. So that's a 60% higher increase of suicide in those active duty military personnel who had low omega-3 levels. And I think that's huge. I mean, think of the implications of that you could significantly decrease the suicide rate in our nation's warriors by supplementing with omega-3 fatty acids. As other examples, vitamin D deficiency has been associated with anxiety and depression. And the so-called SAD, or seasonal affective disorder, may have a basis in lowering of vitamin D levels in the wintertime when we're exposed to less sunshine. And in fact, light therapy, which raises vitamin D levels, has been shown to be an effective treatment for depression. So there really is a lot of relationship that's now being understood between nutrition and mood disorders. As other examples, you may have deficiencies of B12 or folic acid. We had a patient recently who had a relatively rare enzyme deficiency where he wasn't able to create the active form of folic acid, and as a result, the amino acid homocysteine rose in the brain, and high levels of homocysteine can cause neuropsychiatric disorders. And in his particular case, if a healthy homocysteine level was 7, his was 41. And by giving him the activated form of folic acid, which is methylfolic acid, we were able to decrease his homocysteine down to a normal level, and it made a huge difference in terms of his entire mood and psychiatric profile. So basically, there is a relationship between nutrition and mood disorders, and hopefully you can begin to appreciate how important it is.